Today, we're going to talk about several things. We will be discussing the medical diagnosis of your deaf child and how it will affect you as a parent, different professional resources, the deaf culture, education. Early identification and intervention can prevent severe psychological, educational, and linguistic repercussions. But according to California health and safety codes, hospitals must establish a system to screen all newborns and infants for hearing loss. There are two different types of screening for newborn babies: autoacoustic emissions and automated ABR testing. Autoacoustic emissions are used to access the cochlea. A probe is placed in the ear canal, then a tonal or click stimuli is delivered, and the autoacoustic emission is generated by the cochlea, is measured with a microphone. Automated ABR is a measurement that is used to access auditory functions from the eighth nerve through the auditory brainstem. The measurements are generally obtained by placing a disposable electrodes high on the forehead, on the mastoid, and on the nape of the neck. The click stimulus, usually set at 35 decibels, is delivered to the infant's ear via small disposable earphones designed to get rid of any background noise, and then the electrodes measure any data collected by the nerves. There are three different types of hearing loss: conductive hearing loss, sensory neural hearing loss, and mixed hearing loss. Conductive hearing loss is when hearing loss is due to problems with the ear canal, eardrum, or middle ear and its little bones, the malleus, incus, and stapes. Sensory neural hearing loss is when hearing loss is due to problems of the inner ear, also known as nerve-related hearing loss. Mixed hearing loss refers to combination of conductive and sensory neural hearing loss. This means that there may be damage in the outer or middle ear and in the inner ear or auditory nerve. There are 4 different levels of hearing loss. People with mild hearing loss can sometimes make following speech difficult, particularly in a noisy situation. People with moderate hearing loss may have difficulty following speech without hearing aids. People with severe hearing loss usually need to lip read or use sign language and even hearing aids. And people with profound deafness usually need to lip read or use sign language. Your child has been diagnosed with a hearing loss. You may feel confused, isolated, overwhelmed, and devastated by the diagnosis. Often, parents feel guilty that they may have caused their child's hearing loss. These are common reactions that you may be feeling: denial, anger, guilt, depression, acceptance, and even hope. You as a parent or caretaker may have a lot of questions or concerns, and we will move on to different professional resources that you can contact to answer any of those questions. The audiologist is likely to be the first professional you encounter, and possibly the one who gives you the initial news regarding your child's hearing loss. They identify, diagnose, treat, and monitor disorders of the auditory and vestibular systems portions of the ear. Audiologists are trained to diagnose, manage, and treat hearing or balance problems. They dispense, manage, and rehabilitate hearing aids and cochlear implants. They even counsel families through new diagnosis of hearing loss in infants and help teach coping and compensation skills to late deafened adults. Upon diagnosis of hearing loss, your child will be then referred to an ear, nose, and throat specialist, or one who specializes in childhood ear and hearing problems. This physician's initial role is to determine the specific nature of the underlying problem that may be at least particularly causing the hearing loss. Additionally, the physician will also determine if the problem is medically or surgically treatable, and if so, provide the necessary medical treatment. To learn proper speech production, including correct articulation of speech sounds. If you choose oral communication for your child, the speech therapist will help your child acquire the different range of speech sounds and guide the family to additional medical or audiological treatments if necessary. And then any concerns you may have about your child's hearing should be brought to the attention of your primary care physician or pediatrician. What a lot of parents do not realize is that unlike other disabilities, there is a huge deaf and hard of hearing community that has their own culture, and they do not see it as a disability. In fact, they are proud to be deaf. While parents need to seek help in learning about their child's hearing loss, they also need to do the same about the deaf culture. The deaf culture communicates through ASL, which is American Sign Language. ASL is a language that is based on hand shapes, gestures, and facial expressions. The deaf culture is also very proud to be deaf, so they normally look down upon having hearing aids or cochlear implants. We're now going to talk about your education for your child. The first thing that has changed education for children with disabilities is the Individuals with Disabilities Education Act, also known as IDEA, and this ensures that all children with disabilities are entitled to a free, appropriate public education and meet their unique needs and prepare them for future education, employment, and independent living. Prior to IDEA, over 4 million children with disabilities were denied appropriate access to public education. Many children were denied entry to public schools altogether, while others were placed in segregated classrooms or in regular classrooms without adequate support for their special needs. Another super important thing is something called an IEP, an Individual Education Plan. The IEP is meant to address each child's unique learning issues and include specific educational goals. It is made up by the IEP team, which is made up of individuals who bring different perspectives and expertise to the table. Pulling their knowledge, team members set out to craft an individualized response to specific child's needs, taking into account that some children's strengths and talents. The end product is the child's individualized education program. The law also requires that parents are included in the IEP discussion and are to be part of the IEP team. Thank you for watching. I hope this video was helpful in your new journey.